Hi everybody. Well, we still have people joining, but I like to be on time. So I'm going to start off the presentation for today. Thank you all for coming and welcome to those who are joining us right now. So today is a kind of, we've been doing a lot of different webinars this fall related to COVID, most of them, thanks to our sponsorship from Bauer Foundation and Kellogg. We've managed to do a lot of COVID related work. We have today's webinar is a little bit about the work that we've done in Mississippi on a COVID survey of the hospitals to see how the hospitals have been responding. And also just to present our own CHAMPS framework for what's coming up for us in the next few years, because as most of you know, our grant that we had with Mississippi's Kellogg's Mississippi office ended in the summer. We were very grateful for Bauer for continuing that funding. So we do have some presence, but we also have a new grant from Kellogg as well. So we're going to update you a little bit on what we're going to be doing next as well. And then after I've given the updates, Paige is going to present the survey about the Mississippi hospitals and COVID. Next slide, please. So just so you know, we've been doing these webinars every 2 weeks, which will continue with this year. And then back in the new calendar year, we will be doing them monthly again. But the next one coming up is going to be another Mississippi-based presentation. Laura is going to present the results of a study that we just recently did on the nurses' perspectives on baby friendly, and I'm delighted to tell you that just today we found that that study is going to be accepted by Jogan, which is an academic journal that focuses for OB and pediatric nurses. We are doing some small revisions, and that study is going to be published, and Laura's going to present the results of that study on the webinar on the 11th, and then Amy Swales, who works with us all the time, she's going to be presenting some of the frontline perspectives from the nurses in Mississippi during the COVID epidemic. The study with Laura that Laura's first author on is actually about COVID, and not about COVID, it's about nursing experiences during baby friendly, and it's a really fun study. It's got a lot of very cool quotes from you guys down there, so I think you'll enjoy that. Next slide, please. So today I'm going to open this webinar talking about what we're going to be doing right now and what we're continuing to do. Next slide, please. So just some updates. COVID kind of stopped the designation process in its tracks a little bit because since March, Baby Friendly USA have not actually been able to do any assessments, and there were quite a lot of Mississippi hospitals lined up for assessments. Very slowly, they're starting to do some parts of their assessment remotely, and so we have a bunch of hospitals in Mississippi that have signed up for that. And we did get 2 of the hospitals designated during the process because they'd already been through their assessments and they were just doing some fine tuning. So since March, we have had Ocean Springs and Gulfport Memorial designated. So congratulations to them. And also to the fact that, don't let's forget that despite the breaks being on, half of the hospitals in Mississippi are now baby friendly, and over 60% of births in Mississippi are taking place in baby friendly hospitals. So there's great celebration for that. Next slide, please. So the combination of the Bauer funding, which keeps our sustainability going, and then the new funding from Kellogg means that we have now a presence for CHAMPS in Mississippi at least through 2023, which we're delighted about. I hope you're all as happy about it as we are. We're really pleased that we're going to be able to be there, and hopefully we'll get rid of this dreadful epidemic before too long, and we'll actually be able to be there. Most of our presence is online at the moment, virtual, but we're still managing to do a lot of stuff. So this CHAMPS grant, which we're basically calling CHAMPS Ramps, CHAMPS Ramps Up, is through 2023. And the overall goal, just as with all our previous funding in Mississippi, is to increase breastfeeding initiation and exclusive breastfeeding rates in Mississippi and to decrease racial disparities. So that's the overall goal of the grant. Next slide, please. So we have some specific goals and specific aims for this grant, and these are the projects we're going to be working on over the next 3 years. So first of all, we will continue. We're very grateful to Kellogg for recognizing that the combination of COVID and also some of the hospitals just not being able to achieve baby-friendly designation. I won't say within the 3-year time frame, because some of them signed up very late and some of them have actually got very close to designation very quickly. But anyway, we did not have all the hospitals designated as we'd hoped to have by the end of the grant. As I say, we'd have had a lot more done if it hadn't been for COVID. But anyway, Kellogg's graciously agreed to keep funding that piece of the work, which I think we all have as our sort of big goal and standard, that we want to get all the hospitals in Mississippi baby friendly, or at least most of them. So that is still our main goal. As you know, we were designing virtual assessments, but at least we have 2 to 3 years now to do this in as well. So we still have that as our main goal. So we will be continuing with all the baby friendly designation activities. A second goal is to collaborate with Mississippi's historically Black colleges and universities to further education in those places about breastfeeding. And I have to say this, just to give a little background on this kind of came from my involvement with Indian Conchi and many of the tribes when I was working there 2 or 3 years ago. And we found that many of the community colleges on the reservations, they had a very, very dedicated student population who were really dedicated to their communities. And any education that was going through those community colleges was coming up in the hospitals and the clinical setting as something that was very, very helpful for the tribes that they were serving, because they were really dedicated to their communities. So that's part of the thinking here, that if we are seeking to work to decrease racial disparities, then the students at the historically Black colleges and universities are likely to be a key audience that will have a big influence on these racial disparities going forward. So that is why we're going to work with the historically Black colleges. We are starting with Jackson State, who also has some funding from Kellogg. So that's going to be one of our big goals, to work with them to provide interprofessional education, which we already have some modules for that from UMMC, to work with them on specific projects for their students, etc. The next goal is to be working with prenatal care. So this is fairly specific. We're going to be working to do an assessment across the 3 areas of interest that Kellogg has, which is part of the Delta, Jackson area and East Biloxi down on the coast, to assess the quality and quantity of breastfeeding support in prenatal care settings. So some of you may well be hearing us from that in that quarter, because we do have some connections with the hospitals, and we know that the prenatal care sometimes is operated by the hospital, but we're going to be working in community settings and just gathering together the information on the quality and quantity of care in the prenatal setting. And we're going to be doing it as a kind of sort of community health assessment using the MAP framework. So more to come on that later. And then Kathy Carruthers, who today is out of commission, but she is going to be running the workplace support for breastfeeding mothers in Mississippi. Next slide, please. So as you've noticed, 21 Mississippi CHAMPS hospitals have been designated. That's slightly different from the number of designated hospitals, because not every single one has been in CHAMPS, but in Mississippi, but we have had 21% of them designated and 60% of births in baby-friendly hospitals. So as I mentioned, this grant will allow us to work with the remaining hospitals as they achieve designation. Next slide, please. And the way we're going to at least start out with that is virtual mock assessments. So as you all know, we don't have any direct work with Baby Friendly USA. We're very independent, so that there's no conflict of interest anywhere, but we have a good working relationship with them, and they're working on mock assessments. So we have shared the models that we're going to be using. So basically the mock assessments that we can provide to hospitals virtually will be in complete sync with Baby Friendly USA's mock assessments. We're going to be doing some staff training for those hospitals that have not completed the trainings that they need for Baby Friendly, and also the trainers. And I do urge those of you on the call to really utilize the train the trainer framework, because that was always the intention, that it wouldn't just be us training everybody, that now you've got this core of staff who are themselves very competent. They will be doing trainings in the hospitals. We do have a group of hospitals that have mostly through no fault of their own, I won't say exclusively through no fault of their own, but mostly through no fault of their own, had real trouble achieving the Baby Friendly designation. And in the majority of cases, it's a lack of resources, a lack of staffing, their geographical and financial situations. So we are working on coming up with some intensive support plans for hospitals and communities where baby friendly is a more difficult to achieve goal. And I don't want to name anybody, but there are certain areas where it just hasn't happened. And some of those areas we've hospitals that really want to work with us, and some of them, to be honest, we have hospitals that don't want to work with us. And in those cases, we're really hoping to work with the community, again, the historically Black colleges and universities in the area, and trying to really put some outside pressure from the community, from WIC, from the peer groups, from everybody else in there. So we really want to get that together. This funding, by the way, came through last month. So we are in the planning stages. We haven't done very much, although we have designed and performed the first virtual mocks. Then we will continue to support the designated hospitals. That's ongoing. And as part of that, for both designated and planning to be designated hospitals, we continue to collect the monthly hospital data, which is really a great resource that we have data on the Mississippi hospitals since 2014 that tell us, you know, how the breastfeeding is going, and of course it's all good. Next slide, please. So we will be collaborating with them, as I mentioned, with the historically Black colleges and universities, with networking, training, providing educational resources, and the IPE. You will remember perhaps that CHAMPS worked on the IPE that UMMC has just put together, breastfeeding IPE, which brings together all the disciplines, and I'm delighted to say the Bauer Foundation is sharing that resource with the community colleges, and we'll be helping to make sure that that resource gets used. Next slide, please. And then we will be assessing the quality and quantity of support. So I mentioned this before, this is a little visual of the MAP framework, which shows the way that we're going to be approaching this, which includes the community as well as the professional organizations, in order to be able to assess what kind of breastfeeding support and education and preparation is included for pregnant women in these clinic settings before they have their babies. Next slide, please. Now, the part about workplace support, that's probably not, well, that isn't going to start till next year. This will be the years 2 and 3 of this grant, because for one thing, there is quite a big in-person component, and obviously we can't do that yet. So we're hoping that 1 year from now, we will all be free to be in person with people. So we will be assessing lactation support in these areas. We'll be working with local business groups to assess what the kind of accommodation there are. I think we're going to start with the hospital, so you might be getting some questions about that fairly soon, those of you who are based in hospitals, because obviously, especially if the hospital's already baby friendly, they should definitely have thought of their own staff, and whether they have lactation provision for them in the hospital. Is usually a fairly easy sell if you have a breastfeeding room already for patients, or you have some kind of pump set up for patients. You can usually work to include that for your employees, and it's really not a very difficult thing to achieve in a clinical setting. And then one of Kathy's goals, and she has done this in some other states already, would be to create a toolkit for Mississippi employers to facilitate provision of lactation services in the workplace for their employees. Next slide, please. And of course, we have all our collaborating partners who continue to work with us. So we thank you, and we're delighted that we'll be able to keep working with you. Next slide. And this is for Paige. I think we were going to show some slides of data, but I don't think they were in here. So I'll hand it over to Paige at this point, who is going to talk about the response to the COVID epidemic at the Mississippi birthing hospitals. Thank you very much.
Hello, everybody. My name is Paige Beliveau. I'm a project manager with the Center for Health Equity Education and Research. So yeah, I'll be talking about a COVID-19. We actually did 2 surveys, so I'll be talking about both of them and the differences between them. So next slide, please. The guidance on caring for postpartum mothers and newborns during the COVID-19 pandemic is evolving as new studies and guidelines emerge These guidelines are sometimes in conflict. For example, in the US, the CDC and AAP have only just recently published guidelines that recommend keeping a mother with confirmed infection and baby together after delivery. These recommendations can influence breastfeeding, which is an important preventive strategy during epidemics. How hospitals are responding to COVID-19 can help guide future policy decisions around global pandemics. Next slide. Communities and hospitals advancing maternity practices. The CHAMPS program works with hospitals to improve breastfeeding through adopting evidence-based maternity care practices and achieving the World Health Organization's baby-friendly designation. The CHAMPS program first started in 2012 and began working in Mississippi in 2014. There are 42 birthing hospitals in Mississippi and 38 are enrolled in CHAMPS. The first COVID-19 case in Mississippi was identified on March 11th of this year. Next slide, please. Since that time, COVID-19 rates in Mississippi have increased steadily, as you can see in this graph of COVID-19 cases by date from the Mississippi State Department of Health. Next slide, please. This graphic depicts the timeline for the release and revision of the major national and international guidelines on COVID-19, breastfeeding, and postpartum care. Next slide. Thank you. The first COVID-19 cases were in Wuhan, China in December 2019. By March 11th, 2020, the WHO declared COVID-19 a pandemic, and on that same day, there was the first case of COVID-19 in Mississippi confirmed. As you can see, the CDC first released its interim guidance on breastfeeding and breast milk feeds in the context of COVID-19 in February 2020, with revisions in April, May, and June. The WHO released their clinical management of COVID-19 in March and a revision in May. The AAP released their guidelines management of infants born to mothers with COVID-19 in April, with the last revision occurring in September. I also want to note that these are not the only guidelines released by these organizations that touch on COVID-19, breastfeeding, and postpartum care, but this illustrates how guidelines like these were constantly changing and evolving during this time period, as new research was also published. Also, as noted before, at many times these guidelines were in conflict with one another. Next slide. Our two main aims were to assess changes in maternity care policies and guidelines in the Mississippi CHAMPS cohort of hospitals, and to compare breastfeeding initiation and exclusivity rates before and during the COVID-19 pandemic. Next slide. Our methods are that we surveyed Mississippi CHAMPS hospitals in the spring and fall of 2020 about the effects of COVID-19 on maternity care practices. Our survey questions are grouped into three categories: the number of suspected and/or confirmed COVID-19 cases, screening and testing questions, and then questions related to each hospital's policy, which include visitation, skin-to-skin care, rooming in, length of stay, and post-discharge infant follow-up. Next slide, please. Our monthly breastfeeding data was used to assess rates of breastfeeding gathered from our hospitals. Hospitals were already submitting monthly aggregate data by race and ethnicity to CHAMPS. The measures we looked at for this analysis included breastfeeding initiation, which is when the infant receives any breast milk during the hospital stay, and exclusive breastfeeding, which is when an infant receives only breast milk during the hospital stay. Our hospitals followed the Joint Commission criteria for excluding patients from these breastfeeding measures. And for the analysis, we compared breastfeeding rates before COVID-19, December 2019 and January 2020, to rates after the pandemic began in April and May of this year. We used generalized estimating equations with a negative binomial distribution, an exchangeable correlation matrix, and robust standard errors to account for repeated observations over time. We also analyzed data overall and stratified by race and ethnicity. Next slide. The results of our survey on hospital policy. We had 38 hospitals 31 hospitals responded. Of the 38 hospitals enrolled in CHAMPS, 31 responded to the spring survey and 26 responded to the fall survey, and 63% of participants responded to both surveys. Next slide. In the spring, only 45% of hospitals had had a patient under investigation or a COVID positive patient who gave birth at their facility, but by the fall, that number had increased to 85%. Next slide, please. When asked about the number of COVID positive patients that had given birth at each hospital, 65% of hospitals in the spring had not had any, but by the fall, 58% of hospitals had had between 1 and 4 cases. Next slide, please. In terms of screening, screening refers to the hospital asking patients about possible symptoms or their exposure. Next, please. All hospitals were screening all maternity care patients for COVID-19 in the spring and fall. Next. But when it came to testing, which is a COVID test actually being administered to the patient, 45% of the hospitals in the spring and 52% of hospitals in the fall were testing all maternity care patients, which isn't a very big change. Next, please. However, the number of facilities not testing any maternity care patients dropped from 23% in the spring to only 4% in the fall. Next. In terms of skin to skin, which is the practice of the naked newborn infant lying directly on the mother's chest after birth and through the first feed. Next. Most hospitals said that they were adhering to their normal skin to skin practices for healthy mothers and babies both in the spring and fall surveys. Next. When asked about skin-to-skin policy for mothers with COVID or who were under investigation, hospitals responded differently in the spring and the fall. In the spring, only 23% of hospitals were encouraging skin-to-skin along with new policies to prevent infection, but in the fall, that number had risen to 62%. Next. Rooming in is when a mother and her infant stay in the same room together from birth until hospital discharge. The infant should not be removed from the mother's room for any care that can be done in the room, such as a bath or physician exam. Next. When asked about rooming in for healthy dyads, next. We see that in the spring, 71% of hospitals were adhering to normal rooming in practices, but this number had fallen to 54% in the fall. Next. However, this is because 46% of hospitals reported strengthening their rooming in recommendations in the fall, compared to only 29% in the spring. Next. For patients under investigation, 32% of hospitals were encouraging rooming in with new practices to prevent infection in the spring, compared to 65% in the fall. Next. For patients with confirmed COVID, far more hospitals were encouraging rooming in the fall than they were in the spring. Next. As for breastfeeding guidance, just over half of the hospitals recommended feeding express breast milk to infants of COVID positive or under investigation mothers. Next. Whereas in the fall, the majority of hospitals were recommending direct exclusive breastfeeding. Next. Hospitals used guidance from a variety of sources to develop their policies. Next. And 73% did make changes to their guidelines over the course of the epidemic following updated guidance from these organizations. Next. 35 hospitals contributed monthly data. So here are the results of our hospitals' breastfeeding data before and after the beginning of the pandemic. Next. We can see here that rates of breastfeeding exclusivity did not significantly change before and after the pandemic. Next. And we also see that rates of breastfeeding initiation also did not significantly change before and after the pandemic. Next. The hospitals varied significantly in their approach and practice in the early stages of the pandemic, when guidance from national and international authorities was inconsistent. By the fall, more hospitals had cared for mothers with COVID-19 and had updated their practices as such. In the fall survey, for patients under investigation or COVID positive mothers, hospitals were more likely to recommend skin-to-skin, rooming in, direct breastfeeding, but oftentimes with extra safety precautions. Next. Rates of breastfeeding initiation and exclusivity remain consistent in this cohort of hospitals, which could be due in part to this cohort's commitment to the Baby-Friendly Hospital Initiative, which places emphasis on promotion of breastfeeding and breastfeeding education, along with skin-to-skin and rooming in. It will be important to continue to follow changes in breastfeeding rates as time and this pandemic continues. Next. Interpreting and adapting COVID-19 guidelines happens at a local level by individual hospitals. Mississippi maternity hospitals adopted a range of COVID-19 policies, but so far breastfeeding initiation and exclusivity rates did not change significantly. Next. Does anybody have any questions? That's the bulk of my presentation.
I just had a comment. Thank you very much, Paige. That was great. I just wanted to say, sort of as a general thing that it's interesting. We've been following these guidelines right from the beginning of COVID. And as you can, when you change that sort of rather glaring slide, something a little softer, or maybe just put our faces up, Metal. The recommendations have really changed from all of the organization. So, it's interesting when we talked about this data, other people have said, oh, well, which are the good hospitals and which are the bad hospitals? It really hasn't been a case of like good or bad hospitals. It's more like, because there was such a range of recommendations out there, like some of the recommendations said that you shouldn't maybe breastfeed, or we'd be worried about breastfeeding, we should just pump. Other recommendations suggested that we separate moms and babies, and others didn't. So hospitals were really able to cherry pick, but it really was not their fault. It wasn't their, they took stuff from different guidelines, and it's been very interesting to see as those results show that as the guidelines have become clearer and more consistent, the hospital's policies also have kind of unified and honed in on the actual guidelines. Of course, those of us who are breastfeeding advocates and researchers, kind of knew from the beginning that it was highly unlikely that babies were going to get sick from breast milk, because breast milk protects against viral infections. It produces the antibodies usually, and really the science has borne out what we kind of instinctively said. And I think it's interesting. One of my colleagues, Melissa Bartik, who's an MD at Harvard, said, we were looking at, out of an abundance of caution, we should be kind of separating moms and babies, and actually really the approach should have been, out of abundance of caution, we should breastfeed and keep the babies with the mothers, because that was really always likely to be the most healthy scenario, all things considered, and not just looking at it from the sort of Western medicine where we have access to antibiotics and care and all sorts of things if babies get sick, but from the global perspective where, unless there's something really serious going on, breastfeeding is always going to trump anything else, because so many children will die if they're not breastfed, regardless of what else is happening. So that's my commentary on the situation. I don't know if anyone else has anything else they would like to share or bring in. Questions, comments? Anybody want to share what their hospital's been doing? I mean, I have to say the other thing, well, there's two other things actually. As we've looked at these data, we have seen some non-significant trending to a widening of the gap between black and white breastfeeding rates. We have analysed, it's not significant, but it seems to be continuing. So just those of you in the clinical setting, please take care, because we do think that possibly there is, for whatever reason, and we have no reason, we don't know, we have no research to show us a reason, the gap between black and white breastfeeding rates during this period has widened. And we are very proud of the fact that before this, it narrowed. So that's important to say. And then the other thing, I have discussed how Paige presented the results saying that, the averages haven't gone down, which is great news. But in individual hospitals, and we have access to that data, some of them have gone up and some of them have gone down quite dramatically. So it's important to recognize that these results are not necessarily true for your hospital. We need to keep on our toes. Some hospitals have done a lot better than others in terms of maintaining the breastfeeding rates. And the other one thing I would add is that because the hospitals exclude babies from medical, if there's a medical condition that prevents skin to skin, a hospital won't count that baby in the study. So if they're saying that COVID is a reason to exclude a baby from skin to skin, then we wouldn't know that. We don't know that the skin to skin rates, and that's why we haven't presented them, because skin to skin and rooming in, babies that are COVID sufferers or their mothers are COVID sufferers may well be excluded from those entire charts. So we don't actually really know if apart from the survey, we know from the survey whether people have changed their policies, but we don't know from the data whether people have actually stopped putting babies skin to skin because of COVID, because we don't have the data if the baby was excluded in the first place. I hope all that makes sense. Any questions from anybody or comments? I don't know if it is Maytal, I don't know if it's possible. We were going to include the breastfeeding rates, and since we have a bit of time, if you have access to them, I don't know if you do have access to them, but we could put them up, because you know it's important to recognize that not only have we now got all these baby friendly hospitals, thank you, that's great, but we also have changed the rate. So this is our most recent data, and we always present this when we're kind of doing our updates. So this is initiation of breastfeeding, and the dotted lines represent the trend. So you can see since we started to get data, you know, Mississippi CHAMPS started in 2014, since we started to get data from the program, which was when the hospitals had figured out how to collect it, which was January 2015, the initiation rates went up. You can see at the end of this chart that drop in the black breastfeeding rate. So just so you're oriented to the chart, the blue line is the average. The yellow line is the white population, and the orange-red line is the black population. And again, we collect the data for all racial minority, all racial groups. But because black and white are the two biggest racial groups, we just put those on there because the rest of it gets too many lines and you can't read it. But you can see there that orange line has dipped. It may just be a point in the data that's not significant. You can't tell until it keeps dipping or it maintains that dip, but that is what we've been concerned about recently when we've looked at these data. So we really need to track that to see if that's a consistent falling off, or if it's just by chance that happened this spring. Next slide, please. And then this is exclusivity, which again, you can see a similar trend that the black line has gone off, but you can see that over time, even with that drop right now, the rates have all been going up since we first collected data in January 2015. For those of you who are not familiar with our data, this is hospital data only. It's collected very scientifically, it's analyzed very scientifically, but it's the hospital sending us the data from when mothers are in the hospital, so it's only for the first few days after birth. And I would point out that despite the fact that we've increased the rates, you know, we still have a very long way to go. So we're glad we've got CHAMPS ramps, and that's one of the reasons that CHAMPS ramps is going to be looking at things like prenatal care, because when we ask the hospital nurses why are these rates still so low, they all say, oh, because the prenatal care is no good. So that's not true. They don't say because it's no good. They say because the prenatal care has deficiencies in it and they come in not knowing what to do. So there was a lot of concern about whether mothers are coming in prepared in the first place. There are millions of other reasons that these rates are not high, but we did get funding from Kellogg to look at the prenatal care, as so many of the nurses in the hospital thought that might be the problem. Next slide. Do we have anything on the rooming in and skin to skin or not? Never mind, it doesn't matter. That's the most important stop, is the breastfeeding. So any more questions? No? Well, I certainly don't want to hold people on a webinar if we don't need to. So there's no point in going over time, much longer. So I think we'll sign out. But if anybody has, oh, Linda, did you have a question? Hi, Linda. Why have we not seen you for so long?
I know, we kind of retired, okay? Sorry about that. Anyway, we are still in Starkville, still supporting you. And now our local LHU League is holding Zoom meetings once a month. And then the Family Center is now holding Zoom childbirth classes. So that's something that I just wanted to let you know, that LHU League can't hold in-person meetings like we really love, that we have to go to the internet and do Zoom meetings, which is what we're trying to do. So our support is still visible in Mississippi, but maybe not as lively as it used to be.
Linda, I'm curious because, and I'll get to Kimberly's question in a minute, which is a critical one too. You know, Tawanda, who runs a lot of groups in the Delta with WIC, they've actually had improved attendance since they've gone online. I'm curious what your group attendance has been like since you went online.
We have about probably 2 leaders and 3 moms who have been attending. And hopefully after the childbirth class that was just held in the Tuesdays in October, we hope we'll get some of those to attend.
You haven't seen an increased attendance because of online?
Yes, we have.
Oh, you have.
Because when we were on campus, when we were on campus, we had no students come by. I guess it was just a bad time. And so online, we've had 3, and we're very excited to have a mom, a pregnant mom, and a working mom.
Okay,
so
great.
That's what's going on in Starkville. Okay, just wanted to. We are alive. Okay, we just haven't attended any meetings or conferences lately. Okay.
Thank
Good
you.
to see you. Vince came by and he said, "Oh, I remember Ann." So Vince remembers you too. Okay, Ann.
Of course, you guys are unforgettable, for sure. Kimberly Ramsey from the Mississippi WIC has said here on the chat, which it sort of is worryingly sort of backing up what we've seen, that the WIC initiation rates have dipped somewhat, or between 46 to 49%, and before COVID they were headed upwards. So it's definitely a trend that we really need to watch, guys. You know, we can come up with theories as to why lower income women or African American women may not be breastfeeding in this period. We don't have any real data to show, information to inform that, but you know, those of us who've worked in this field can probably think of some reasons. So we definitely have to be careful. And thanks, Vicky from Merit Health Wesley. They're doing online services. Is that prenatal? I'm not sure, or postpartum, but anyway, attendance has increased. So it is interesting, even though La Leche League's numbers are not very big, that both all La Leche League and the WIC Delta baby cafes and Merit Health Wesley have seen increased attendance at their sessions. This is definitely something we should be thinking about, because you know, maybe younger people do prefer these online sessions, and especially if you've got a baby, you don't want to go out. We should not sort of think that they're less valid than the in-person ones. I think we should definitely learn from that. Anything else anyone wants to chat in or speak up about? Okay, well, thank you.
Just so happy that you're going to be with us. So happy that you're going to be with us till 2023. We don't want you to go.
Thank you.
We want to hang on to you.
We're very happy to.
Thank you.
We're really happy. So, and hopefully we'll be actually there in person before too long. So thank you all for attending. Thanks, Paige, for your lovely presentation, which Laura actually is also presenting this week at the American Public Health Association meeting. And that's why some of our team are not on here, because they're presenting on that meeting today. So that's a big online meeting. And our CHAMPS conference is coming up, also going to be online in May. And we're working on a save the date, but at the moment we have a date of May the 19th, and it will be a virtual conference, and we're going to try and make it very exciting. So stay tuned for that. I have to say that there's an advantage to that as well, which is that we've managed to get some very big speakers from different areas. Diane Spatz is speaking, Rafael Perez Escamilla. We have some big speakers, and we wouldn't be able to get all those. And Michelle Owens from Mississippi is also going to be speaking. So it's going to be quite cool, because we will have some big speakers and big draw. And we're going to offer CEs as well, CEUs. Okay, thank you, Linda, for your kind comments. Thank you for your input, Kimberly, and let's get together on working on why we're seeing this decrease in rates in some of the populations that most benefit from breastfeeding. Thank you all very much, and take care, and let's be in touch. Okay, bye-bye, everybody. Thank you.